Vancouver, British Columbia has long been ground zero for what is now a North American-wide epidemic of opioid addiction. The city has struggled with the ravages of intravenous drug use for decades, and in response, it has pioneered many successful yet controversial harm reduction strategies. In 2003, the city opened North America's first legally sanctioned supervised injection facility, which was championed by Dr. Mark Tyndall, who is now director of the BC Centre for Disease Control and who is also a vocal supporter of vaping as a tool for harm reduction. Mark Tyndall is an epidemiologist, physician, and public health expert. An author on over 250 academic papers, Tyndall has dedicated his career to studying HIV, poverty, and drug use. In a recent TED-Med presentation, he argued for greater adoption of harm reduction strategies to combat the opioid crisis. Stiff opposition to harm reduction isn't relegated to safe injection sites. Countless personal stories and scientific evidence demonstrating vaping as a safer alternative to smoking are ignored every day by the same public health officials that advocate harm reduction in cases of hard drug use. It's an irony not lost to Dr. Tyndall. In April, a public forum scheduled to discuss safer nicotine products, which was organized by the Global Forum on Nicotine with the BC Centre for Disease Control, was abruptly cancelled after stiff opposition from public health colleagues. Undeterred, the event was reorganized into a private workshop aimed at public health professionals and hosted at the CDC offices in Vancouver. RegWatch was there with exclusive access, and here now is Dr. Tyndall with some surprisingly frank comments on vaping. So this event is happening here today. Why is that?
Well, from a public health, if you put the priorities of public health, I think smoking cessation still is #1 thing we should be worried about, and so hasn't come to the forefront in public health as much as it should as far as solutions go. And my personal opinion, this kind of dialogue really needs to happen.
Are more Canadians dying of smoking than any other habit, or?
Oh, by far. Right now we're in the middle of our opioid epidemic crisis, but the actual numbers, which are staggering, pale in proportion to smoking-related deaths that are happening. So we're saying, in Canada, 4 people are dying a day, and it's not nowhere near how many people are dying of smoking-related causes.
Now, obviously, I've been covering this issue for quite some time, and still that astonishes me to hear that.
Yeah, well, it's as I said at the beginning, I really got interested in this because for the last 20 years I've been working in harm reduction for HIV and hepatitis and these kind of drug-related harms, and everybody I've followed clinically or dealt with in clinical trials are pretty much all dying of smoking-related problems. So we've kind of pushed that to the side. So you smoke 2 packs of cigarettes a day, I'm really interested that you take your antiretroviral drug. And nobody's dying of HIV, but many people that I deal with clinically are succumbing to smoking-related problems.
So if there is no alarm over smoking deaths right now, why is there so much alarm over vaping?
Well, I think that one of the paradoxes is in public health we think we are making progress in smoking. So if you look at the year-to-year smoking prevalence, things are slowly ticking down. Not as many youth are smoking anymore. If you compare it to 4 or 5 decades ago, I guess we've made quite a bit of progress with smoking prevalence. But all of a sudden we have a disruptive technology that could really change things very quickly, and somehow we think we're doing fine, I think, so, eventually. But, we know there's close to 5 million active smokers in Canada right now, and my feeling towards this technology is we can help those people now, and some of the prevalent statistics are driven by people dying of their smoking, and so to me, we owe some attention to those people, and if we can make their lives healthier and reduce their risk of smoking-related deaths, then we have to act.
So as a doctor and as the head of the BC Centres for Disease Control, what's your professional opinion on vaping?
Oh, if we could switch tomorrow and have all our smokers vaping, it would be miraculous. We'd have a huge impact in smoking-related deaths and smoking-related illnesses. The morbidity associated with the illness associated with smoking is all, often we just measure in how many cases of lung cancer and how many heart attacks and those kind of things, but how people debilitate themselves over time, and how somebody who's 50 years old looks 70 years old and can't get around anymore. I mean, these are huge impacts on our communities and societies, and if we could offer people some better product for their nicotine, I mean, to me it's just a no-brainer.
So as a doctor, you'd recommend vaping to a smoker?
I find myself, when I'm on the street, just bumping into strangers and saying, you should really vape. And with people I see vaping, I always give them a pat on the back and say, it's really good. You're doing something to try and make yourself healthier. How could we tell people not to vape? I mean, it's, I guess, in the end of the day, it'd be better if they stopped smoking. But we've done that experiment, and many people, I don't think I've met anybody who smokes that hasn't tried to stop. So, and because that's another compelling argument, that we're dealing with a population that's totally on side. Like, yeah, show me something that's safer. Show me something that'll make my breathing better. Show me something that won't lead to lung cancer, and I'll use it. So we have a very captive audience in this, and in public health, I think we really need to offer people that alternative.
Now, public health, there seems to be quite a bit of a divide. This is a dividing line, this issue, very strongly. Why is that, and what kind of pushback have you actually had with regards to this event?
Oh, well, it's a long story. There's, I think there's certainly public health as policy have come out quite negatively towards vaping products.
Why?
Well, I think it's somewhat based on do no harm policy. So a lot of our health interventions are really focused on the unintended consequences and what if. And in this particular area, it's really about starting new people on the road to smoking. So, and focus, what about our children type thing. And so there is a reluctance to do anything that could jeopardize our what we think is our success in reducing smoking. So the last thing we want to do is open the door for any opportunity for youth to take up smoking. I'm under the impression that that's very unlikely, that I don't think there's any evidence for this gateway thing, but that's something that we should monitor, and I'm certainly not against putting up any kind of regulations that would make it less likely for youth to take up vaping and smoking. But
if one youth did pick up smoking from vaping, is it that worth stopping vaping for everybody else?
Well, it's if the unfortunate child who died of an airbag in a car, that doesn't mean we've abandoned airbags. So I mean, there will be some unintended consequences like any of our health interventions, but in the whole scheme of things, I think saving the lives of current smokers more than offsets that. It
strikes me there's the old wives' tale that I certainly even heard when I was a kid, and I know that for decades and decades before me, moms would say to kids, don't start smoking when you're a teenager because it'll stunt your growth.
Okay.
You've heard that, right?
Sure, yeah.
Is that any different than nicotine harms developing brains?
No, I think that's the same message for sure. So as we've had some discussion here today about what nicotine is, there's really no evidence to that. I don't think we want to expose our child's brains to any substances, but
but it's the same old wives' tale.
Same old wives' tale for sure. And I know a lot of people who have smoked their whole lives, and their health is bad, but in many cases their brains are fine. I mean, I think that we just, as we've really tried to pull apart today, I mean, there's a nicotine that people crave that makes them continue to smoke, and there's all the other terrible substances in combustible tobacco that we need to save people from.
Well, that's it for this edition of RegWatch. Before you head off, please like us on Facebook, and don't forget to follow us on Twitter. For RegulatorWatch.com, I'm Brent Stafford.